Good morning and welcome to Shriners Hospitals for Children in Cincinnati. My name is Tammy Robbins and I'm here today with Randy White, our hospital administrator. Welcome, Dr. White.
Good morning, Tammy. Cut.
And I called you Dr. White, but it's Randy, sorry.
Thanks for the promotion, though.
Yeah. How are you doing today?
I'm doing very well. Happy to be here with you.
Great. I'm glad you're here today because we have some really important things that we want to share with our viewers on social media today and throughout the Shriners Hospitals for Children in Cincinnati constituency. So we know that you follow us from all over the country because we provide amazing life-saving care at Shriners Hospitals for Children. And we're glad you're joining us today to learn more about how we in Cincinnati are keeping our patients and families safe from COVID-19 while continue to offer our world-class care in burns, cleft lip and palate, and reconstructive surgery. But first, I think we'd like to learn a little bit more about you, Randy. First of all, we know you're not a doctor because I made that mistake, but tell us a little bit about your background because I know that you're a little bit new to Shriners Hospitals for Children.
Yes, I joined Shriners in 2019, July actually, and even though I'm not a doctor, I have two master's degrees, one in business administration and one in healthcare administration. For the past 23 years, I've been working in healthcare in Indiana, Texas, and West Virginia, rural and urban. So I've got a very, very good background. Grew up in Southern West Virginia, met my wife at Marshall University, and we've now got two kids. And even though I don't look like it, I've got a college graduate, another one in college. So just doing great things.
Great. Well, you know, we love to hear about the folks in our Shriners family. We all like to know who we are because it's more than just, you know, what we do for our kids and what we do for a living. We are all a family. So I want to talk a little bit about, I'm sorry, I've lost my way in my script here, but, you know, people will bear with us. Some of these questions were submitted by parents of our followers on Facebook. So we do want to thank those of you who reached out to us to ask these questions. A mom in Cincinnati has asked us a two-part question. My child has an appointment soon. How safe is the hospital? And what changes have been made to keep everyone protected from the virus in your hospital?
We've been doing a lot to keep patients and their families and our employees safe at this hospital. First of all, we're on several regional committees, so we know what's going on in our county, in our state. We're tracking international and national information also. But our highest priority is here at the hospital with our patients, our families, and our employees. So we are doing screenings on a daily basis. If you're an employee coming into the hospital, you will be tested for daily factors, but you also be ensured to be wearing a mask if you're out in public. Obviously, a lot of hand cleaning going on, a lot of deep cleaning of surfaces that our housekeeping crew is doing. We are following CDC and Department of Health guidelines here at the hospitals. So we're having fewer employees in the hospital. We've got a lot of people that are working at home, but we are very focused on making sure that we're controlling our services here and as much as we can of what's coming into the hospital.
And I think it's probably important to point out that because we are a specialty hospital focusing on burns and reconstructive surgery and plastic surgery, that we are not treating COVID patients in our hospitals. So really, you know, another doctor made a point to me that Shriners Hospitals is one of the safest places to be.
That's absolutely true. And unless it's an emergency, we have a process in place to have patients pre-tested before they come here or to ensure that the travel here is the most efficient and safest travel that we can possibly get them to our location with. So knock on wood, so far we've had very, very limited exposure to COVID-19 here within Cincinnati Shriners.
Great. I think that that's something very reassuring that our patients and families, you know, are loving to hear, and especially our members of the fraternity that support us out there are awfully proud of the work that you all are doing to keep patients and families safe during this time. So COVID struck us at a time when, you were doing some pretty big planning for, an announcement that your hospital made last year about your move to being a hospital within a hospital at Dayton Children's Hospital. And we've been getting some questions about our upcoming move to Dayton Children's Hospital. And because of the pandemic, it's been a while since we've been able to update people. Want to reassure folks that the pandemic has not slowed down the progress of that project, but it's slowed down our ability to inform you about it. So Randy, can you give us an update on, what's the progress on this project and what's the latest information?
Well, the good news is Governor DeWine here in Ohio decided that construction at hospitals was an essential process. So during the whole COVID corona issue, construction of our hospital within a hospital at Dayton Children's has never stopped. It is on target. We're still looking around mid-February for that date, and we're very fortunate for that. And it's going to be beautiful. I get to go up and see it on a very irregular basis, but what we're doing is going to be very nice and very appropriate to continue the Shriners' mission to take care of the patients that we have.
I can tell you that those of us in marketing communication are very excited to get rolling on this, to be able to share photographs and project updates and those kinds of things with our followers and our constituencies coming up very, very soon. So stay tuned with this. What can we look forward to seeing in the new hospital when we move? How is this going to benefit our patients and our families?
Well, even from entering the hospital, first thing you're going to find is more than ample parking. We will be inside of the Dayton Children's Hospital. So there are 3 magnificently large facilities to park in up there. There's also surface parking, so parking will never be an issue. Dayton Children's is an ultra-modern, high-class, high-functional, world-class children's hospital. We're very proud to be part of that. Now, our section, which will be on the 2nd floor, is going to be very kid-friendly, very family-friendly, but it will be right-sized for us and the mission that we're doing in taking care of the burns and the cleft lips and the cleft palates. So this will allow us to right-size and to use our money as efficiently as possible to take care of the kids that approach us for those needs. And we look to getting back to full capacity very quickly once we get up there.
I think it's super exciting for us to be, taking our world-class, leading care. I mean, because Shriners Hospitals formed the field of pediatric burn surgery, and just a mere 50 years ago. And to bring that and our level of expertise to such a great campus that has great services for children who need all kinds of care is really a partnership that is going to be great for the children of Ohio and in the Midwest.
Well, I think the word that you used, campus, was the exact perfect word to use, because being in the hospital, we will be able to tag into some of their medical professionals and possibly be able to do things that we've never been able to do before as a standalone hospital. But across the street is the Ronald McDonald House, which we will be working with to help our patients offset their travel costs and their staying costs as we're working with their loved ones at our hospital. But it'll just be a bigger footprint for us totally, and it will be a campus field where we will use many of the resources out of Dayton Children's, but the core essence of what makes us the Shriners Hospital will be on that 2nd floor, and we're very proud of this arrangement and we're very excited to get up there.
Well, this is all such great information, Randy, and I'm excited to watch the progress in the next few months. And we're excited to be able to share that with all of you, our viewers and our fans. Perhaps someone else from the Cincinnati team or you could join us again to update our social media followers here in the near future.
Would love to. Thank you.
Great. Well, that's all for us today at Shriners Hospitals for Children in Cincinnati. We are so glad that you joined us today. If you'd like to make an appointment for your child to get the most amazing care anywhere, or if you'd like to make a contribution in support of care for our kids, check the comment sections of this video or find us on the web. Thanks a lot and have a great day. Thank you, Randy.
Thank you, Tammy.